78% of women were being misdiagnosed or having a diagnosis missed when they went into hospital or went into the emergency saying something's wrong with my heart. And as we progressed over the last 6 years of the Canadian Women's Heart Health Alliance, we've identified that it's a different type of heart disease. It isn't your heart has coronary arteries sitting on top, and those get plugged when you have a heart attack, and because they're delivering oxygen to your heart. And that isn't the type of heart disease women have. So they go for the tests that we have always recognized where the plugs are at, and you have a lesion that has to be fixed. And the cardiologist will say, well, there's no lesions here, so it mustn't be your heart. But we have discovered it's still their heart. It's just all the microvascular system. And we don't have tests to diagnose that right now.
Like to present day, we don't have tests.
To present day, we don't have tests for that.
How significant, like if you were to compare that discovery or that advancement of understanding in your field, how significant is that? Is that like Is that the internet? Is that rockets to the moon?
It is. It is absolutely. When we finally recognize that it's a different type of disease, we can start really advancing on what we're doing in women's heart health.
I had a faculty member who said, I'm doing a research project looking at the birth control pill and its effect on blood flow to the kidneys. And I'll be honest, this is really early in my research career. I had never thought about the birth control pill doing anything other than preventing pregnancy. And it actually has a lot of other effects in the body. It changes your blood pressure. It increases your blood pressure reversibly, but it does increase your blood pressure. It does change, we found from this project, blood flow to the kidney. And we do know that now, because we have started to collect this data, that worldwide, women are more likely to have advanced kidney disease than are men. I'm not saying this is all due to the birth control pill. I don't want anybody to make that jump. But, just to recognize that there are differences in terms of like, it doesn't matter what, we talked a bit about heart disease, and Dr. Norris is certainly the expert in this area. But really any chronic condition, any health condition is affected by our sex and our gender. And when I talk about our sex, I'm talking about biology, I'm talking about our genetic complement, I'm talking about our physiology, our reproductive hormones, our anatomy. And then when I talk about gender, that interacts with sex, but this, we often think that's gender identity, and that certainly plays a role, but that's also the roles that we play. Are we the caregiver at home? Are we the primary earner? Our relations that we have with each other. And of course, there's institutionalized gender. So that's like the distribution of power and resources in society that affects people of different genders differently. So all of these things, I like to tell people that, and this is not my quote, but other people's, the world writes on the body.
Well, a lot of the research institutes across Canada are labeled as maternal, child, newborn. So they focus on maternal health, which is very important, but then it excludes what has been alluded to. We often exclude that postmenopausal, the mature women's health. 50% of our population is women, so 50% of people are going to go through menopause. There are issues like endometriosis, polycystic ovarian syndrome, fibroids, pelvic pain, urogynecology, which is what I focus on. So 1 in 3 women will develop a pelvic floor disorder in their lifetime, and this can include peeing your pants or having pelvic organ prolapse. And our team at the Lois Hole Hospital for Women, which is supported by the Alberta Women's Health Foundation and my endowed chair in research, has done a lot of work on that. So we've looked at immigrant women and their lack of access to care. We've looked at rural and remote health. And we actually looked at ergonomics in the workplace. So you look at surgeons and their positioning in the OR, and 70% of our surgeons have pain while they're operating. How would you feel if your surgeon has pain while they're operating? And there are sex and gender impacts of that, as has been alluded to, in terms of, are they the caregiver? Are they then going home and looking after their families or their elderly relatives? There's a difference between females and males. So we talk about that whole, I don't want to come back to it again, but the procurement issue. The surgical instruments for women, they don't fit. They were made for men. So women are more likely to have challenges in terms of operating. So that's something that one of my summer students, who's a kinesiology student, Noah Martin, is looking at that and looking at the effects in the OR. So there are all these different pieces that sort of interlink into training and provision of care.